It's nice having an interaction with you, speaking with Ikoro News. Esther, we learned that your health facility is actually be launching in Abia very soon. And so many you might not be aware of what this facility is all about. So we want you to explain to Abians what they should expect after the launch of this health facility.
First of all, I want to introduce myself. My name is Chief Dr. Chief Priest Gabriel. I'm from Isingo in Abia State, actually in Umuahia North local government in Abia State. And we will be launching True One Health services, and this is going to be one of its kind, which is all in one put together in Abia State. We have a clinic, we have a pharmacy, we have a laboratory, we have a consulting firm where we will consult with the nurses and the doctors, teaching them on new laws and new things about healthcare. And also we are very excited to bring in home health into this, and we should be sending doctors and nurses to the homes of our clients. So we are really very excited because our motto for this clinic is bringing exceptional care closer to home. So,
all right, sir. So, what we want to wonder, I've read your profile, been a medical practitioner in the United States of America, and we are at the time where people are actually living, especially medical practitioners are actually leaving the country to go and practice elsewhere in Nigeria to establish health facilities outside of Nigeria. So, one wonder what actually prompted you to actually want to set up a health facility in Nigeria?
We are going to make Abia great. We are going to make Nigeria great. That's my goal. That's my passion. That's the hallmark of my life. Every investment I have in Nigeria. Currently, I own some hotels. I own schools. We are opening clinics, and every business I have, everything I do, I love Nigeria and I love Abia State in particular. So I'm one of those people that believe that Abia will be great, and I'm always excited to bring back things home, because it does not matter wherever you live in the world, home is always home. When you come back home, you don't have a good place to go. I realize that there are no good facilities to really visit. When you come back, people are telling you, make sure you're not sick when you go home. Make sure you're not sick when you go home. That's what everybody says. But I want to bring home quality health facility where people can come back home from any part of the world and they're going to receive quality care.
Okay, sir. Fine. Let's talk about the True One Health service outfit. Now, I want to know what's this health facility about. What does it contain? What kind of services should people be looking at? In land, you're going to have a pharmacy. You're also going to have a laboratory, a clinic. So, what's the quality of service we should expect, and what kind of?
You should expect top of the notch. Actually, the doctor that is coming with us is a foreign trained doctor who understands the quality of care, and he's going to be the chief medical practitioner for True One Health facility. I am hoping to also employ some doctors from elsewhere, from outside the country, to come and run this in collaboration with our locally trained doctors. We have a pharmacy, as you said. We have a hospital. It's like a very short stay facility. People can come in for a few days, stay and go back home. It looks like a hotel. It was all made with air conditioner all through for all our rooms, and with television and everything. And also we have state-of-the-art theater. So we are going to be operating on people in this facility. There's going to be theater for operations and for people giving birth to their children. This is the best place to be, because we are going to make sure the quality of care is going to be in line with the quality of care that we give in the United States of America.
This is like bringing US to Nigeria. I think this will actually reduce medical tourism, but however, there's one thing that has actually propelled. If you look at the climate where we are, there's that drive for self-medication, and most times even the government clinics are always overcrowded. And research has shown that this most times has a lot of the high cost of seeking healthcare, private healthcare. So you now coming from establishing a private health clinic, how do you actually want to douse this tension, these fears that private healthcare is expensive, to actually make people going to seek for medical help rather than self-help or going to already overcrowded public health facilities?
As a philanthropist and also a humanitarian person, we own the Hopi Foundation International, and we have been in this for years and years and years. I want also the facility not just to be a money-making machine, but also to be a humanitarian place where we can also reach out to some people that are very indigent and people who could not really afford healthcare. So at least once a month, at least we're going to provide free medical care here in this facility. We should be able to reach some of our people who could not really be able to afford healthcare. And also, like we said, we are going to take this to the homes. Even people who cannot come out, we're going to take healthcare to their homes through the qualified doctors and the qualified nurses that are going to take care of that. So we are going to make it more or less easier for people to be able to access healthcare, because we're not just in this to make money, but we're in this to touch lives, as my goal is always.
Alright, so while we walked in, we are seeing that you're putting finishing touches to the building, and already information has already been given out to the public that we're officially launching on the 30th of April.
Yes.
So for now, what are the preparations on the ground?
The preparation of plans, by 30th, we already hired all the nurses, hired all the doctors, hired the laboratory technicians, hired the pharmacists. We've gone through all our accreditations. We are getting all that through the pharmacy council, through the laboratory council, through the Ministry of Health. So we've gone through all our accreditations, and hopefully by 30th we're going to be cutting the tape. On the 1st, the doors will be open for our clients to come in, and we are ready to hit the road.
Alright, so you've said you've done all your accreditations and coming, although yes, we know you're Abian, and you've been around, gone through your bio. Before you left, you actually schooled in
yes, I did.
Yeah, so that means you're familiar about, you've been away for a while and you've seen the system that works. So what has been the challenge? Setting up this health facility. What has it been like? What has the job been like?
One of the biggest challenge we had was to get the approval for this building. But thank God we finally got the approval, and I thank the director for the building plan in the state. They helped us make things, Mr. Woken, make things a little easier for us. But at the same time, it was a big challenge, to get electrical things done, to get plumbing things done, to get pool permits. Everything was a little rough, but I've gone through that before. I know what happens in the system, and I try to work with people. And for the fact that we are here to change Abia, everyone is going to fall in line. I know it's not easy, but definitely I encourage people, I encourage all our brothers and sisters within the US to also come back. Let's build this state, let's build the state that we have, because if we could not build this place, nobody can build for us.
Alright, so fine. I like that some of the challenges and whatever. So what has it been like in terms of support among maybe colleagues, the health practitioner and whatever, within and outside Nigeria? What has been?
I mean, honestly, most times when you are doing things, people don't really support you until they see that you're working. People are not used to going through hoops and hurdle. That's why so many people don't open nothing, especially people that lives in abroad, and they try to say, no, we don't want to deal with all the problems. So it's been like friends and family supporting me and trying to say, okay, let's do it, it's going to work. But I knew it was going to work because I'm very resilient, and I always hit the target for whatever I go for. And now things are working, everybody's happy, people are really running around and they're happy, and there's a lot of joy around that this is coming to this place.
Alright, sir. We are also aware that you're a philanthropist. Founder of Hopi Foundation, which has actually been won in 2017 Abia Fact Philanthropist of the Year. Now, sir, there's one thing people don't know how to do is differentiating business and philanthropy. So, I've known you as a philanthropist, and I believe this is
it's a business.
It's a business.
Yes.
And it's supposed to actually make money for it to run. Even so, how do you intend to actually dissociate the philanthropic aspect from the business aspect? Because people know you. This is one they know you. This is Dr. Madam G, the owner of Hockey Foundation. That might people tend to misunderstand that fact.
Yes.
You can actually work in there and
The thing is free.
it's free. So how do you intend to manage all of those?
That is why I'm a philanthropist. My business is a limited liability company. What I do is that I employ people who runs the business. Even me, when I come to this place, trust me, I am going to pay to be in this place. So everybody that is coming, whenever I want to use this place for my philanthropic business or philanthropic gestures, definitely I'm gonna be paying for this facility to use this. So I completely, I have an MBA in health administration, and I know what it is to separate business from philanthropy, and that is why I hire the people who are gonna run the business. And if I need to use the place for my philanthropic gestures and what I do for humanity, definitely, like I said, my plan is once a month do something under my foundation, and the foundation will definitely pay for whatever I do here as per philanthropy.
All right, sir. So you know nothing you challenge that likely might face, and I want to know how you handle it. When something in business is new, health is something some people are already familiar with a particular, maybe you have health facility they're used to. So sometimes they're skeptical what's the quality of the staff. So how do you profile your staff as a health practitioner who is knowledgeable in the field? The staff strengths you have, how do you profile them? There's a competence, ability to deliver, how do you profile them?
Already, we have about 20 people already hired. I did complete background checks on the staff. I checked their history, their job history. I call their references. I try to check on them to make sure that they have good reference and people that has worked for them before. That's how I profile my staff. And trust me, the crop of staff that I hired for this, they are top notch, and I know that they're going to do well.
All right, so let's digress a bit. So we conclude, let's digress a bit. Currently now, I'm sure you are aware of your bill that has been proposed by the House of Representatives that's proposing for trying to stop health practitioners, especially medical doctors, from traveling abroad. So the law actually proposes that you have to wait for 5 years before you have a full license. Yes. So how do you react to this? Do you see this as welcome move or?
Honestly, I read that and I felt like, you know what? Honestly, they did not pay for them to go to school. You can now determine what they should do with their certificate. If you want them to stay in Nigeria, make Nigeria good. If you want someone to, like you are now, let's say you're a doctor, I want you to stay in Nigeria, I pay you well, you stay here. Most people are leaving the country because of the way the country is. If they make the country habitable, people will stay here. If they make the doctors comfortable, they're going to stay here. So I do not agree to that bill. But at the same time, I encourage the doctors to try as much as possible. If you go to Cuba, most of our doctors are paid better than most doctors in Cuba. But they still stay in Cuba. They make their place work. But at the same time, the doctor on their the government on their end needs to find a way to make the doctors happy instead of trying to force them to stay here after because they're leaving because there's nothing for them. If you're taking care of your people, you're taking care of your staff, they're not going to leave. I own a hotel. Most of my staff, I've never owed. You can verify whatever I say. I've never owed my staff 1 day after any month, 1 day after any month for 3-4 years now. I pay them on regular basis. Whenever we want to fire anybody, you have to get the police to get them out of the door. They don't want to go. They will cry. They don't want to leave, even though they're being paid peanuts. To me, I feel like it's not really a lot of money. But still, they don't want to go because at least at the end of the month, they are 100% sure that the money is there. So if you say you want to keep your doctors, pay them well, keep them, give them their money as at when due. So when people feel frustrated, they move. That's what happens in the workforce, that's what happens in the war, that's what happens everywhere. You can't keep people down based on the fact that you feel that you have the power to do that.
Alright, so I'm concluding. What you have to tell Abian team, what you want to tell them about the One Health service, through One Health service outfits. So you summarize all the details of this.
Honestly, Abia is on the way to the better things. Abia, we will continue to work for Abia until Abia gets good. True One Healthcare is up to run. Your pharmacy is here. Your medical doctor office is here. Your laboratories are here. Your home health is here. In general, we are going to give you quality health care. That is my goal. That has been my dream, and that's an actualization of the dream. I'm happy to be an Abian. I'm happy to be an Ohonho man. I'm happy to be one of those who are making things work for our people.
Thank you very much, sir. Thank you for talking to us in Koro News. Wish the True One Health athletes prosperous business environment in Abia, and honestly, launch, and we know it is a contribution to the growth of the healthcare sector in Abia, and we wish you very well.
Thank you so much, and God bless.